At Vascular Surgery Associates, one procedure we perform often for patients with leg swelling is called a venogram. Patients are laid on their back with their groin exposed. We then use lidocaine to anesthetize the region. The femoral vein is then accessed under ultrasound using a needle and a syringe. The patient is entirely sedated at this point in time. We then access the vein with a small wire. Under X-ray vision, we then advance a larger wire and a small IV called a sheath into the vein. A catheter that obtains ultrasound images is then inserted into the vein, and we obtain ultrasound pictures of the vein from the inside. Using these pictures, we can identify whether or not your vein is narrowed and needs treatment with interventions such as balloon angioplasty or stents. Using a combination of ultrasound images and X-ray fluoroscopy, we determine the best location and size for your stent. We use precise measuring tools to measure the reference diameter of the vein and appropriately size the stent. An entire team consisting of doctors, nurses, technologists, and anesthetists are involved in the procedure. Here, we see a stent being deployed within a patient's iliac vein under direct X-ray vision. This final picture reveals that the vein previously narrowed is now widely patent. Final confirmation of this procedure is then performed with repeat intravascular ultrasound. The patient has been asleep at this point for approximately 20 minutes. At the end, the patient's small skin incision is closed and dressed, and then they are awoken from anesthesia.